This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider.
It's been the worst 3 weeks of my life working in this sector. I can't describe how difficult this has been for residents, for the staff, for the families, for the management team to have been dealing with this for 3.5 weeks now.
The UK's care home bosses, like Nicola Richards, who runs Palm Row in Sheffield, are facing a crisis like nothing they've ever seen before. More than 2,000 homes across the country have registered a coronavirus outbreak, putting the elderly inside at risk and those who look after them.
I found out a colleague has tested positive and one of our staff members is in intensive care. And it's just incredibly tough at the moment.
It's an emerging catastrophe, a visible sign of the pressure being brought down on a country that is still to see the peak of COVID-19 infections, and Westminster remains empty. The Evening Standard's editorial column says the building can be closed, but the MPs must still hold the government to account.
We need Parliament back, not just as a symbol of democracy's resilience, but to do a job that matters. The Leader of the Commons, Jacob Rees-Mogg, says it will return next week, but he hasn't said how. When so many people are working from home, there should be no reason why MPs can't too. And as the Hansard Society and the Constitution Unit point out today, that means an effective Parliament without MPs having to travel. Just allowing a few dozen of them to ask questions of ministers over a Zoom link isn't a substitute. The Commons should prioritise action on coronavirus, drop irrelevant business such as private members' bills, strengthen committees to grill ministers, and set up an encrypted secure online voting system to get legislation moving again. It's a route to the sort of effective Parliament which we need anyway.
Among questions that could be asked is what is the true death toll for coronavirus? Figures from the Office for National Statistics suggest it's far higher than we previously thought. The Evening Standard's health editor Ross Lydall joins me now over Zoom. And Ross, how big a difference is there?
Well, basically, there is about a 50% difference between what we know now and what we were told at the time. This isn't necessarily to blame the government or the hospitals supplying these figures, but what the ONS has done, and this is obviously retrospectively, with the benefit of time, the couple of weeks to really crunch the numbers and to look outside hospitals as well, it's basically found that over the period of up until the start of April, the government had declared just over 4,000 deaths. ONS said for the similar period or the same period, the true number is 6,235. To be fair to the government, it didn't know any better at the time. It was relying on the best evidence it had. But it does show that really these figures have to be taken with quite a pinch of salt when we hear them each day at Downing Street or from the Department of Health Twitter account.
So we're starting to get a much clearer picture now, aren't we, of how hard coronavirus is hitting this country and London especially.
That's right. So basically, the significance of today's figures is one, that the data we're given each day is not as up to date as it could be or is not as accurate as it should be. And two, that about 10% of the deaths are actually happening in care homes or in the community. And there's this great unknown, really, exactly how many people are dying outside hospital. In relation to London, in terms of the number of deaths, yesterday we had 158 deaths in London. Today we have just actually received a statement from NHS England, just as we are mid-podcast, that of the 744 people who died in the last 24 hours, or whose deaths were reported in the last 24 hours, 206 are in London. So that's a jump up again, and that does essentially show that the deaths reported yesterday in London were subject to something of a lag over the Easter bank holiday, which is not unexpected.
And as this new picture is becoming clearer. In fact, even before these figures were released by ONS, there have been some doctors and health experts saying that they think Britain will be the hardest hit country in Europe by coronavirus.
This sort of started towards the end of last week when US researchers predicted that the UK would be the worst hit in Europe, and their statistical model was to a degree discredited because it was using old figures, and obviously there's been a massive increase in these beds as the NHS rushed to get ready. In fact, it's reported today in the Health Service Journal that only 19 people were in London's Nightingale Hospital over the weekend because hospitals are still able to cope. They still have the capacity in their wards, albeit they're expanded wards. But then on Sunday, in probably a more meaningful intervention, Sir Jeremy Farrar, who is the chief executive of the Wellcome Trust, which is a massive charity that funds lots of medical research, and he's also on the government scientific advisory committee, he said that it's entirely possible, if not probable, that the UK would come out worse. Now, the thing to remember, of course, is that there's no other city in Europe as big as London. You've got nearly 9 million people here, and that obviously does not help in terms of transmission. We probably take our national pride and think, well, we should do better than Spain and Italy, which have been the two that have been rather setting the pace in Europe so far. And we look enviously upon Germany, which seems to have been doing much better in terms of far fewer deaths. But this is a concern, and what today's ONS stats essentially are doing, and this is for the second week in a row, is showing the number of deaths outside hospital. So really, we're now getting more statistical evidence of what Jeremy Farrar and others are saying, that when we look in the round, both in hospital and in the community, the numbers are underpublished and are creeping up, and the truth is much more alarming than we've been told so far.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.